100.9 FM, 1570 AM, WOKC, Okeechobee's True Country. Folks, we have on the phone lines with us this morning Dr. Ken Redcross, MD and author of Bond, the 4 cornerstones of a lasting and caring relationship with your doctor. And our topic this morning is Beyond COVID, a secret winter weapon test you must take. Good morning, Doc. How are you doing today, sir?
Hey, good morning, Billy. Thanks for having me on. Good morning, everybody.
And as I do with a lot of our interviewers, where am I calling you from this morning? What part of the country?
I am in New York, right outside the city, actually.
All right. And it's probably a little cold up there, isn't it?
Oh, yes. Oh, yeah. I told you guys that sometimes life just isn't fair. It's about 20 degrees down here. I know out there in Florida it's just the opposite, so I'm extremely jealous right now. All
right, we're here to talk about this book that Dr. Redcross is the author of. It's called Bond, the 4 cornerstones of a lasting and caring relationship with your doctor. Dr. Redcross says vitamin D has been in the spotlight since 2020 because of how it reduces COVID symptoms and deaths. However, he says this inexpensive, simple vitamin solution has been his secret weapon, a secret weapon of his for improving many other health concerns for patients, including depression, viral respiratory infection, premature births, sleep deprivation, and type 2 diabetes, with nearly 90% of Americans being vitamin D deficient. And as we head into the dark winter months, absorbing vitamin D from sunlight is even more challenging, especially to those with darker skin tones. And in this summary, it says you stress the importance of having your doctor test your vitamin D levels or testing with an at-home kit so you know exactly how much vitamin D to supplement with, especially since everyone's body processes vitamin D differently. Doc, I want to just start with these questions. What do you think has contributed first to the spike in COVID-19 deaths?
Well, look, guys, right now we're all kind of getting to a point where we're kind of having a little bit of COVID fatigue, if you know what I mean, Billy. It's been a year. It's unbelievable that things have come that quickly. But look, we're all doing what we can, whether it's social distancing, wearing our masks, or washing our hands. And as you mentioned here at the top of the segment, we do have this secret weapon, which is vitamin D. But it's more than just vitamin D, actually, Billy. You don't know about your vitamin D unless you guys check your levels. And that's the whole thing I wanted to really make sure that if anyone is listening today or when they're listening, that they leave home with this. Know your levels. Let's make sure whether you go to your doctor's office and get your levels tested, you can do that, Billy. You can even go to a website called thepowerofd.org. There, everyone, you can order an at-home test kit so that you can get your levels. But the point is, get them done, and you want those levels between 40 and 60. That's kind of the sweet spot where we start to get a lot of the clinical benefit.
Why is vitamin D so important to the coronavirus conversation?
Well, because when you're thinking of vitamin D, and as we mentioned, look, vitamin D, everyone, it's not necessarily a prevention or a treatment. It's what vitamin D does for our immune system, to help support our immune system to fight things. Not only just the coronavirus, but also the same for influenza as well. As you mentioned before, there's some great data with vitamin D and its benefit to help support our lung function and help us with immune function and those sort of things. So it's not about bone health when we all kind of learned as kids that, you need vitamin D for your bones. That's true, but it's a much bigger story that we're seeing with vitamin D now, and that's why it's important to know where your levels are.
Is there any data showing that vitamin D actually helps with COVID-19, though?
Oh, yeah, there is some good data. In fact, there was a correlation study done out of Indonesia, and it showed that those who had vitamin D levels that were less than 19 was actually associated with 100% mortality. But on the flip side, those who were over 34 with their vitamin D level, guess what? 0 mortality. And so this is the reason why there's so much excitement and so many newer studies going on about diving in even deeper to vitamin D, whether you, once again, go to your doctor's office or thepowerofd.org. That's not as important to me as all of you out there knowing what your levels are.
Well, what type of education is needed around the COVID vaccine from your perspective, especially for minority communities most at risk?
Yeah, look, the most important thing, you need to get the education out to recognize that this isn't a brand new vaccine technology wise. Yes, we just got it approved for the coronavirus, but it's been around forever as far as the actual technology of this vaccine, which is pretty miraculous if you think about it. The other thing, think about all of the money that was really put into this, not just in the United States, Billy, but over the entire world to really get this pushed to get a vaccine that actually works. So then I think the other thing that's important as well is to have the right messenger, especially in the minority communities where there's been some healthcare disparities that's really made it really difficult for minorities to trust the medical system at times. So there's a real grassroots effort that really needs to take place as well.
Generally speaking, what are your black patients most skeptical or compared to your white patients when it comes to COVID-19?
Well, everyone, I mean, some of you may be familiar and may not, but many years ago there was an experiment called the Tuskegee Experiment in which African Americans were really tested or not given a treatment for a study done on syphilis. This is back in 1972. So the point is that these patients were not offered antibiotics when they could have been treated. And even that skepticism 30, 40 years ago still lingers within the community. There's some other, horrible stories like that as far as minority treatment, African American in particular, that once again lingers throughout, generation after generation. So, that's why I say there needs to be a grassroots effort, and there needs to be a really good education as to why this vaccine is important and more data on why we should be able to trust it.
Is there anything that black doctors say or do differently than white doctors that could make a major difference in how black patients respond to health recommendations and prevention strategies?
Look, guys, I don't think it's a determination of black versus white on how we deliver care, but I do think at the root of everything, it needs to be the things that I mentioned in my book, Bond: trust, respect, empathy, and communication. And I think if we have that, regardless of how much melanin we have in our skin, we can actually kind of transcend all of these challenges we're having, especially without healthcare. So I don't think it's different there necessarily, Billy. I just think, at the end of the day, you have to make sure that you're invested in one another and invested in the patient. And I think the patient feels that.
All right, where can we get more information about what you've talked about today?
Sure, guys. So, look, my website is drkenredcross.com, and I really mean it. Reach out to me on my social media handles, whether it's Instagram, Facebook, Twitter, and that's Ken Redcross MD. Say hello, ask questions. I always love meeting new people.
How can we challenge our friends and family members to test their vitamin D levels?
That's the fun part. You guys get there, you put the challenge down like, look, I'm going to get my vitamin D level checked. We're going to do this every 3 to 6 months. And some people like to wager a little bit. I'm not a betting man there, Billy, but you can maybe wager a good meal at a restaurant and have fun with the family. Make it a true challenge, because not only is it a challenge that you're going to win, but your health is also going to win. So you can't beat that.
This might not be in the lineup of questions, but let me just straight up ask you, what are some things that we could be eating or drinking to increase our vitamin D levels?
Well, Billy, that's a little bit of the challenge, is that vitamin D is not particularly rich in our diets. People will mention milk, but milk has fortified vitamin D. That means that it's added, everyone. So that's why I joke around and say get on my level when you talk about vitamin D level, because you can't get it in your diet. Usually you have to supplement. You can get it from fatty fish. I typically get mine out of sardines for some, but even with that, you can't get your levels high enough consistently enough to get the benefits of vitamin D. So it's one of these things that you have to really supplement, everyone, even if you're getting some good sources like some fatty fish in. So just keep that in mind. Get a high-quality vitamin D as well, whether that's Sprouts or Whole Foods or wherever you guys are in the U.S., just get it from a reputable source.
Doctor, I want to thank you very much for being on with us this morning. Folks, this is Dr. Ken Redcross, MD, author, Bond, the 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor. Doc, we sure appreciate it. Very informative information. Looking forward to, glad to be able to share this with our community in Okeechobee and around the lake. And we thank you very much for your time.
Thank you, Billy. Take care, everybody. Have a blessed day.
You as well, sir. Bye-bye.